So welcome. My name's Dr. Mika Schofield, and I am a general otolaryngologist at the Ohio State University Wexner Medical Center. And I want to welcome you all to our webinar series, Minding the Gaps. This is the part one of this webinar series entitled Married to Medicine. I was inspired by this particular topic as my time as the chair of the Women in Otolaryngology section for the Academy. And I was reading this book entitled The Medical Marriage. It's written by Dr. Wayne Sotile and his wife, Mary Sotile. And I thought, wow, there is such good information in here. So I actually reached out to the authors. And when I reached out to the authors, I actually happened upon our guest speaker today, their daughter, Mrs. Rebecca Fallon, who's a clinical psychologist. Rebecca received her degree in clinical and health psychology from the University of Florida. And for the past 10 years, she has served as the director of the wellness services for the Sotile Center for Resilience. This center specializes in coaching and consulting for physicians and medical organizations. Rebecca also serves as the behavioral health consultant for Atrium Health, providing psychosocial support to both patients and providers. Rebecca is a co-facilitator for the first Health of the Carolinas Physician Leadership Academy, where she provides educational seminars and leadership coaching for physicians and APPs. She has also enjoyed a prolific career as a public speaker and has delivered invited addresses to Cleveland Clinic, University of North Carolina School of Medicine, Emory University, Long Island Jewish Medical Center, and many more. Rebecca feels honored and privileged to help physicians and their families navigate the unique stressors of medical family life. So please join me in welcoming Rebecca as our guest speaker for this webinar. Thank you, Rebecca.
Thank you.
So before we move into our interesting discussion, I'm hoping, I want to give my panelists an opportunity to, one, introduce themselves, tell us kind of what you do, and if you could just share how long you've been in your particular relationship. So why don't we start with Carol and Dave Bradford. Welcome, Carol, Dave.
So good evening, everybody. Really wonderful to be here with all of you. So Dave and I have been married for 41 and a half years, and we actually met in college, so probably knew each other nearly 4 years before we were married.
Great. Wow. Dave, is there anything that you wanted to tell us about yourself?
No, I'm just here to share what I learned along the way.
Okay. Yolanda and Caroline, do you want to tell us a little bit about you?
Oh, sure. And thank you, Minka and Rebecca, for having us here. We're really happy to be able to participate in this important event. So I'm a general otolaryngologist, and Caroline and I have been together for 25 years. And Caroline is so wonderful that she met me while in my first year of residency. So it's been, and it was interesting in the start, and it continues to be interesting. Yep. Caroline works as a writer, and I'll let you tell a little bit more about yourself.
Okay. The difference between us is she's a scientist and I'm very creative. So that alone probably is two different levels, but this is going to be an interesting conversation.
Okay. How about we move to Angela and Greg?
Hello, I'm thankful to the WIO, Minka, Rebecca, for inviting my husband and I to be a part of this discussion. And I'm a general otolaryngologist and solo private practitioner in Plattsburgh, New York. And
we have been married now for a year and a half, July of 22. So we're we're still in that newlywed stage. We started dating back in the beginning of 2021. I work for a company out of Buffalo. I work remote, managing an MSP, managed service program out of Buffalo. And over the past 10 months, I've been actually sitting in Dr. Powell's practice, doing payroll, purchasing, procurement, and APAR for her in my spare time.
Okay, and then lastly, we have Kavita and Raj Dadia.
Thank you so much for having us on this webinar. We met in 2007 at an away ENT rotation and started dating in 2008. We had dates along with our ENT interviews that we had gotten together. And we have been married since 2010, so it'll be 14 years, man, in June. I'm currently a pediatric ENT surgeon at CHOP, and I will let Raj introduce himself as to what he does.
I'm an ENT at Penn, so we've been hopping around together, which is another struggle with trying to find 2 academic jobs, but it's worked out really well. So happy to be here and happy to share whatever you guys want to know about what it's like for 2 ENTs or 2 people in medicine.
This is great. I'm so excited to hear the perspectives of everyone. Before we dive into our conversation, I just want to remind our participants that this will be recorded. And if you have any questions that you would like answered by our panelists or Rebecca, our guest speaker, please enter your question into the Q&A section, and we'll try to get to your question towards the end of our discussion. So first, I'm going to turn it over to Rebecca. So your practice has decades of experience working with medical families. In your opinion, what are the primary challenges faced by medical couples and families today? Basically, why are we even having this discussion?
Yeah. Well, first of all, thank you so much, Dr. Schofield, for inviting me to be here. I really do consider it an honor to work with physicians, and hopefully our group has kind of a unique understanding of what some of these struggles for couples and families are. I want to give a quick disclaimer at the beginning. A lot of what I'm going to say, I'm going to use the terms men and women. That is not in any attempt to be, non-inclusive. All of this stuff applies to non-binary people, trans people. I will also talk a little bit about the research on physician marriage. The vast majority of it has been done in heterosexual marriages, and I'll expand on that a little bit. What we know from the research that's been done in same-sex marriages is that most of the same issues are applicable, regardless. Certainly same-sex couples face some additional challenges, but just as a disclaimer there. So, it's interesting when we think about the challenges of medical families today, 2 really significant things have happened pretty much in the last 2 decades that have sort of changed the landscape. One of those is that women have entered medicine in droves in the last 2 decades. So almost half of medical residents are women at this point. Almost half of surgeons are women. The other thing that has changed in the last 2 decades is that family has really entered the hearts of men physicians, in a way that it had not for previous generations. So today's male physician is much more focused on family, household, much more involved than probably the generations of men before him were. So this struggle of work-life stuff is a relatively recent phenomenon. So in the 70s, there was a big study surveying physicians, are you stressed by this juggling of work and family? Now, this was in the 70s, so most of the respondents were men. And only 15% of them said, yes, I'm stressed by that. Most of them were not stressed at all because they had a very clearly defined role, which was to work. If I show up and I work and I support my family, I am thriving. I'm doing what I'm supposed to be doing. There wasn't a lot of this ambivalence that we see these days. So now these days, over 80% of both sexes say work, family, juggling stress is a primary stressor in my life. So this has sort of changed the landscape for medical couples, medical families. Couple of other things I see clinically in my practice as being very significant are the level of accessibility physicians are required to have now, with EMR being, you know, a constant nagging thing you've got to attend to, with, you know, patients can text them, you know, they need to be so accessible. That did not used to be the case. And so that obviously presents a challenge in how much emotional energy people even have for their relationships. So when our group did a big survey of physician couples, we partnered with AMA Alliance in 1999 and actually just repeated it in 2023, surveying almost 1,800 physicians and physician couples. And what still appears to be true is, working the way physicians work, you're likely to be coming home irritable, frustrated, and too tired to engage. Not always, but often. And a big predictor of marital satisfaction is how many hours you spend together a week awake. Okay, awake. And I would also say present, not checking the phone, not sneaking away to do charting, but that just quality of time is so vital in physician couples. And so a lot of the things I just mentioned certainly have sort of changed the game in terms of how possible that feels for medical families today.
That is quite intriguing, and I like how you've taken us from 1970 to current day and really kind of that evolution and how it's changed. Do you think it's any different with surgeons? So are we a different breed than just the other types of doctors?
Yes, you guys are crazy. No, I'm kidding. Y'all are, you know, it's so interesting because I would say what the research would tell you, well, I'll say this. You got to think about who becomes a physician, right? It's the good little boys and girls who decide to work hard enough to deal with what is required to become a physician. So that's a sort of self-selecting process right there. Personality of physicians in general, to generalize, this is certainly painting with a broad brush, they tend to be logical people. They tend to be ambitious. One thing that's key, they tend to be real good at just go numb and keep going, because you have to do that in order to survive medical training, certainly to survive surgical training. All of those skills may be very, very helpful in your job and not so helpful when it comes to relationships. So, you know, the more brutal your training is, the more you would adopt this sort of go numb and keep going mentality. And of course, we know surgical training is the most brutal. Integration becomes more difficult the more time I spend out here in the battle zone, you know, kicking butt every day. So finding that softer side of me, you know, I've worked with so many physicians over the years who say, it's such a 180 I have to do. I had an electrophysiologist years ago who would do, you know, these 6-hour AFib ablations and talk about all this stuff all day long. And she said, then to come home and just try to be like interested in, you know, whether my daughter peed in the potty that day, just felt like this harsh 180, or understanding what was stressful about my spouse's job when the stuff I've been through today, the things I've seen, the trauma I witnessed, or I, you know, had a child die. I mean, the stories you hear of just truly being like on the battlefield is what it feels like. And then to come home and have any kind of coping energy is difficult. But I will say for surgeons specifically, I think what it takes to become a surgeon is a very important set of characteristics to consider. I think what it takes to become a woman surgeon is a very important thing to consider. I think what it takes to become a surgeon who is a woman of color is a very important thing to consider, because women in medicine really have to walk this line, you know, the challenge to find my authoritarian voice. Yeah, I worked with a resident once who had a really high-pitched kind of quiet voice. She was a surgical resident. And what she said was, I get feedback all the time. You're not controlling enough. You need to own the OR. We can't hear you. You don't convey confidence, you know. So she progressively worked on that. And then eventually she got told, you're too loud. You're too aggressive. You know, women are going to get labeled, and women of color very quickly will get labeled too aggressive, too assertive, whatever it is. So figuring out how to walk that line, and the almost role playing women have to do in medicine, I think often results in this complete emotional exhaustion and perhaps a lot of anger and resentment. I don't know. I'd be interested to hear from the panel if that's been your experience, but that's a little bit of what I have seen clinically in terms of what may differentiate surgeons specifically. The last thing I'll say about that, if we're looking at women in surgery, and the effects on marriage, I think we do have to consider some logistical stuff that just seems to be true across the board. So we know that women who become physicians tend to marry later. They tend to be trying to have children later if they want to do that. We know that fertility issues affect surgeons, women surgeons, at a disproportionate rate to the general population. And so, I think it's worth considering the toll that takes on a marriage, and the stress of that as well is, not to be overlooked.
Wow. I mean, I think this is very interesting information. Does anyone one of the panelists want to chime in on some of what Rebecca has said? Okay, Carol.
So really, really fascinating information. Thank you so much, Rebecca. And I should say, I'm a head and neck cancer surgeon in an academic practice. I've been a very busy head and neck cancer surgeon scientist, and now I've been a chair, executive vice dean, and now I'm the dean of the medical school that Minka is a faculty member at, and she served on the search committee that brought me to Ohio State. And Dave is not in medicine. He is a project manager and engineer by training. So, I would say a lot of things. So we were married. I was 22 when we were married. So we actually married young. I married before medical school, but we in that era, because I'm older, it was really not accepted to have children during residency. And so we had our two children. I was age 33 and 35, so I was married 11 years before we had our first child. So interesting dynamic there. And then of all of the things, that transition from work to home, and Dave will know, is once we finally had cell phones, one of my strategies, and my drive wasn't very long, it was 10 or 15 minutes, but just so to sort of change from the work person to the home person, I would call Dave on my way home and say, hey, honey, tell me what's going on at home. How are the kids? What's the homework? What's our meal plan? Like, what's sort of going on? So you didn't just totally walk in and sort of not know sort of the situation at home.
Yeah.
Dave, anything to add to that?
It takes a lot of effort to make sure the kids were up at 8 o'clock at night when she came home, and we had very, very good discussions in the morning between the kids and I about why we had to get up.
Yeah.
but yeah, they stayed up and wanted to see mom when she got home.
Mm-hmm.
Well, the way you got what you just said is so important, because I will tell you, one of the biggest predictors of physician resilience, right? Being able to do this and not get burned out. One of the most important factors is having family that not only supports, but better yet, applauds you for the work that you do and feels proud of the work that you do. The biggest predictor of whether they're going to support your work is not how many hours you work, how much call you take, how much money you make. It is your mood when you walk in the door, when you come home from work. That is the biggest predictor of how your family is going to feel about the work that you do. So if you come home every day complaining and exhausted and, in a really negative headspace about work, it's really hard for the people who love you to kind of rally behind that. But what's also really important, and this is what Dave is alluding to, is shaping the family's dialogue about the work that you do. And we have seen both ends of this spectrum. one heartbreaking thing that a lot of physicians deal with is work shaming. You know, a career in medicine is like an unrelenting mistress or affair person who's pulling you away constantly, and you're constantly distracted. And a lot of work shaming happens. So if you you go and fight the battles you fight every day, and then you come home to, well, you missed another bedtime because the kids couldn't stay up because apparently work is more important, or, you know, whatever, times a million, it totally erodes somebody's ability to stay resilient. But if you as a family have a really positive dialogue, and, you know, I've worked with women over the years who have told me the way my husband talks to them about my work is, you know, mommy can't be here tonight because she's helping somebody else's mommy, or, you know, she's saving lives. She's a superhero doing really important stuff. And yeah, we miss her, but when we get home, we're going to, you know, tell her how proud we are of her. And, you know, you can shape the way your family and particularly kids feel about what does it mean, the work that you do. And that's a really important variable for sustaining resilience for the one who's out there doing that work.
So one follow-up comment, I think that is incredibly important. I think it's really wise. I would say that fortunately, I was blessed to be in a home life where the work I did was appreciated. And I would also personally talk to the kids. Oh, mommy is getting called away. And one of my favorite stories, it all worked out okay, but it was like Halloween time, and a little girl was running with a wand in her hand, and it, of course, got impaled in her throat a long time ago. And I said, mommy has to run to the hospital right now because you remember how I said, again, not blaming the patient, but remember I said how important it wasn't to run with, you know, things in your arm, you know, sticks in your hand. And so unfortunately, mommy has to go, and a little girl, you know, that happened to her, and I have to go in right away because I literally had to be really rush and make sure everything was okay. And then I remember I came back much later that evening, and I, you know, saw my daughter, who is a fourth-year medical student pursuing medicine. And I remember saying, you know, kissing her goodnight and said, mommy's back now. And she said, is that little girl okay, mommy? And I said, oh yeah, she's going to be just fine. She just took out her own tonsil and she's going to be perfectly fine. So it's one of those help your family realize what your work really is outside of medicine, not sharing any confidential information, but just some stories.
Yeah. So, you know, I want to kind of, we think about this and all that we do as physicians, surgeons, and we think of it as this kind of noble profession. But with this noble profession comes all of these stressors. Do you think we somehow have just normalized this so that when we think about it, we don't really think about it as this is a stressor, this is a stressor. Oh yeah, by the way, that's a stressor. It's normal to us, but for our partners, it's like, what's going on here? So you think that is part of what's happening in this situation?
Yeah, I mean, I will say, I think medical training teaches you to really normalize a very deviant level of stress and sleep deprivation and hours worked. So to those of us who have not been through that, it does sometimes feel crazy. I will say that's one of the advantages of two physicians married to each other, is like you both get it. You both understand how, you know, a 10-hour day turns into a 14-hour day, and there's nothing you can do about it. You both understand what it feels like to have a really sad, traumatic day. You both understand the gravity of feeling like you made a mistake and there was awful consequences. Like, there's a lot you can share in understanding each other's stress. And so, you know, I think it is important. It has been a point of study for decades, is sort of like, who has the best personal lives? If we look at physicians specifically, what cohort of them? What the research suggests is there aren't huge differences in terms of the workload in affecting divorce rates. So research suggests physicians at a total cohort are at neither greater risk of divorce or at greater advantage for marital happiness than anyone else. But that's not great, because we're all at pretty high risk. 40 to 49% of us get divorced, right? what I think is important is what you said, Dr. Schofield, you do sort of normalize the demands. So if you look at in the general population who works 60 plus hours a week, only 8% of people, 44% of physicians work 60 plus hours a week, probably more than that if you count charting at home and all of that extra stuff. And so again, you know, the point here is that when we don't have any margin and we normalize that, we're running the risk of just running out of coping energy. We have like bank accounts of emotional energy, physical energy, spiritual energy, energy to connect with our spouse, energy to parent. And when you're working with no margin, when you're just living in survival mode and you've adopted that kind of go numb and keep going mentality, it's just really hard to emotionally show up for any extra stuff because you're kind of running on fumes.
Yeah. So I want to turn it over to the panelists because I think this is a great transition point to kind of look at our lives and kind of do a self-assessment. Are we living a more toxic life or a more nurturing life? And so something that came up in the medical marriage book was one of the simplest ways to assess stress in your life is to ask yourself, is this a more toxic, meaning am I feeling more anxious, frightened, miserable, or just generally uncomfortable life? Or is this a more nurturing feeling that I have about my life? Meaning, do I feel in general appreciated and acknowledged for what I'm doing? So I'm going to turn it over to the panelists. I'm going to let's start with Raj and Kavita with this one. Since there are two ENT couple, if you had to evaluate your partner, do you think that their life appears more toxic or nurturing?
Toxic. No, I would say more nurturing. And again, as Rebecca had alluded to, you know, not only are we physicians, we pretty much do the same thing, went through similar residencies. And, you know, even with that, there were definitely differences that we noticed, like during residency where, you know, we may have had different experiences, but now I think that we're attending, we really empathize with each other's days, or if something's happening, or, you know, we're like, oh, he has a grant due, and I think it's just being, you know, being supportive of that person because we know what they're going through. And so I think in that way, it's nurturing. I don't know how he feels, but
yeah, I'm gonna. You can't say anything but nurturing in this situation. No, this is but yeah, exactly. I'm not going to sleep in the same room. But you know, I think it's been that way. You know, like let's take like what happened last night. So this is sort of funny. We're on this panel today, but Kelly has been on call 4 nights in a row at CHOP, and she went in at 4:30 this morning for an orbital abscess. And I have clinic at 7:45, and there's a snowstorm here in Philadelphia. So the kids are, you know, they call school off. Our nanny's not coming till noon, and so you know, she said she'll be done at whenever she's done at 6:45. And we had to find a way that she could get home and I could get to see the patients. And you know, the kids are now 9 and 4, which helps. But you know, I think what we've learned honestly, is that you've got to be supportive because it all comes back. You know, it's like anything else. The more you put in, the more you get out of it. And so that is something that's hard early on in a relationship. You know, when we were on the match trail, interview trail, we had a lot of, you know, tough conversations about what we wanted is in the future. And you know, I'm a little bit from I would say a traditional Indian mentality where, you know, the man does no more than 49% of the work at home, you know, and she didn't like that very much, and understandably, I'm glad she didn't. But you know, there are a lot of those hard conversations that that you have to have. I mean, I think you have to have, and if I could advise Raj, you know, 15 years ago, it would just be that, just you got to be understanding and supportive. And so anyways, yeah, I think you have to be supportive to survive the relationship, and it really improves it.
Thank you. That's great. All right, let's see what Angela and Greg have to say. If you had to evaluate each other's life and you wanted to say, is this a more toxic situation or nurturing situation as it relates to your partner's life?
Go ahead.
Well, no, we were talking about this question actually before the webinar started, so I'm going to let my husband start because he and I are, this is kind of our second chapter as empty nesters, so we don't have the demands of small children at home to demand our schedules in the ways that Kavita and Raj do, but we have other stressors now as empty nesters that we didn't have back then, right?
Yeah. So we made a very tough decision. This is our second marriage for both of us. I almost feel like it would be good to have your ex here to talk about going through and growing up with a young child in the house. But we had and have a great relationship. But in the spring of 2021, or excuse me, 2022, as we're dating, I'm listening to how things are going at the hospital and the toxic nature of that environment. And but we won't go into the details on that. But we looked at each other and I said, more important than anything, I want you to be happy. And she quit a fantastic job. We sold the house down there. We moved up to the middle of nowhere, which it's nice up here. But our stressors are different now. But the nurture is fantastic because, going through everything, we were in practice about 6 months and we had to fire our medical services company and just really put us in a bad spot. So I put my stay-at-home office in the office with Angela, and the long days, I'm right there. I'm right down the hallway. She pops in. We have lunch together. It's amazing. And it really is. And our stressors are the same. We get to fight and argue with suppliers and we argue with each other, but we're able to be like, well, what's the best thing for us and the practice? Should we be closed these days or should we go away for a weekend together? So it's really given us a nice feel to be able to nurture each other in this position.
Yeah. I like that evolution and actually recognizing a very toxic environment and choosing to shift into one where you can have a more nurturing kind of life. That's good. Yolanda and Caroline, you want to chime in? Toxic versus nurturing.
Well, I'm going to chime in. So we have no children and we don't work together. So I would say it's a complete balance. So I see her stress, the pager goes off and she turns into a different person. And, but then I see the love for what she does. So I just keep quiet and I let her go through her explosion, I should say. And then she is exploding in the household and is a lot of swear words. And then she gets on with the patient. She's like, yes, dear, I'm going to help you. That's great. And she's lovely to the patient. And I understand it because it's what she loves. So I'm willing just to let it go and just let her do her thing because I think she's brilliant at it. And I can't understand it because I don't do it, but I understand the emotion.
Oh, that's wow, well said. I would have to say that I have always been supported by my wife, and not only my wife, but my wife's family. So her mother and father, when I had a ceremony to go to in Chicago for the American College of Surgeons, they were right there with me. And that meant so much. So they have been on this entire journey through residency and practice and moving practice till today. And it feels so loving and so supportive and so important that they recognize what it is that I do. And they always give me the space to do it. So I'm very, very fortunate. I'm spoiled.
Yeah, we think she's a superstar.
So I'm spoiled.
That's great. So you're the superstar. I love it.
Yeah, she is.
Dave, if you had to, now I know that Carol does a lot. So I'm interested in knowing, like, from my view, it seems like it would be toxic. But Dave, what do you think? Toxic versus nurture.
Well, let's say that I learned to do many things I had no anticipation of doing when I left college. You know, for a decade, we went off and did whatever we wanted to, whenever we wanted to, because we had both means and time. And then we had children, and I might take a smile when the group of moms go, "Oh, he isn't a single dad," at the fundraiser in April, because they've seen my wife for the first time that year. But we also, you know, the kids also ended up sitting in their car seats on the bar while we waited for a table, and we would go to all of our meetings as vacations for us. So there were lots of fun things to do.
Mm-hmm. Mm-hmm.
And I guess the one thing I did learn is sometimes I'm supposed to listen and not solve things.
That is a very good trait.
I'm not good at it, but.
Okay, Carol, did you want to chime in on this at all?
So sure. I mean, I think that, you know, I think that there are really seasons in a relationship as well as in a career. I think when your kids are young, if you choose to have children or have children, you know, those are some pretty stressful times, and you have to have, you know, plan A, plan B, plan C, plan D, and then all the plans. You have a stay at home, or you employ a nanny, but then the nanny gets sick. I mean, there really are so many or you have health challenges in the family, and your niece, your Dave's brother's family lives with you for 100 days when your niece undergoes a bone marrow transplant, and then your daughter gets RSV, and you have a free flap scheduled the next day. I mean, unbelievable, but true. And I can tell you, you know, many decades later that everybody lived. I actually wondered if anybody would live at one moment, but you just, you have to support one another. You have to have people, you have to have a village to surround you. And in the tough days, that's the only way you get through it. And I also think that you really need to have personal and professional priorities. And I always wanted to be there for important events in our children's lives. Our daughter was a gymnast, ultimately a collegiate gymnast, and our son was a hockey player and a tennis player. And so we, you just somehow figured it out. I talk about, I don't think it's ever balanced, work-life balance. You try to integrate work life, and I actually talk about this. I actually think you try to achieve work-life harmony, where there's really harmony between your professional life and your personal life.
Mm-hmm. I agree wholeheartedly. I like to use integration for sure. Rebecca,
And the kids waking up in the middle of the night and saying "mom" when they're sick instead of "dad" is always great. No matter
what.
I
was always the one to go to the ER if they were really, 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 really sick, right, honey?
Yeah. Or if they just threw up, they'd go, "Mom, it was wonderful."
Rebecca, are you surprised by any of these comments or statements from our panelists?
I mean, you know what, it kind of surprises me how lovingly everyone has navigated this journey. It sounds like, I mean, I realize you guys are all at different stages, and I think that's a really important thing. The thing that stands out to me that's consistent with all of you is what you have is you are congruent with each other about whose job it is to do what. And that is one of the biggest predictors of marital satisfaction. It is vital to have that, particularly if you're married to a physician. You have to be in agreement about, you know, whatever it is. If it's a woman physician and the man has decided to do most of the childcare stuff, that is great. That dynamic works beautifully as long as both people agree that's what we're doing. or I'm taking this realm. I mean, what's interesting is that even in 2 physician couples, women still do about 4 times the amount of hands-on childcare per week. Some of that is because of what you just said, the kids come to mom when they're sick or whatever. Some of that is because we women often shoot ourselves in the foot and think we have to be at everything and be all things to all people. And so it's this sort of thing that just self-perpetuates. It's not because we don't have partners who are willing to do that. But the thing that is most important is having congruence. We agree about, what my job is going to be and what your job is going to be for the most part. And the thing that I heard all of you saying is there's such loving support for what I ultimately want for you is for you to be happy. And I'm not going to shame you for loving your work. I love that you love your work, and we will find what's fun about that as a family. We'll go and do the meetings together or find a way to support you. Or like with Kavita and Raj, using resources is really, really vital. When you are, one of the advantages of 2 physicians married to each other, particularly during the child rearing years, is you got money. I mean, to be blunt, and you got to utilize it. You got to outsource. You outsource childcare. You get someone to clean your house. You pay people to drive you here and there if you need to, because you can get work done on the way, and therefore you have more time for your family. The couples who communicate about that and figure out how to use our resources to maximize, again, going back to having some margin for time to feel good together. And, Angela, I love what you guys said about those changes you made. What you took was, when we talk about stress, the worst kind of stress to have, and the stress that puts the biggest strain on a relationship, is what we call high demand, low control stress. As a physician, you are going to have a lot of high demand, low control stress. The demands are incredibly high and will continue to just grow. And the amount of control you have, at least over the years, we hear from physicians, I have less and less control every year over what I do, what I can do. This system itself is so broken that I feel such a loss of control sometimes. But what you do in those situations is you focus on anything I can control. If I can flip this to feel more high demand, high control, I'm going to feel better. And that's a change you guys make, Angela and Greg, to now you've got this situation that feels very controllable to you. You feel happy. You can choose to have lunch together. I mean, I love that you mentioned that. It seems like such a small thing, but that's a huge thing. So it sounds to me like you guys have all in your own ways, and, with having family support, you guys have all figured out how to navigate this in a way that sustains the resilience, not just of the physician who's doing that work, but of the relationship as a whole.
Yeah. So it seems like our conversation is just progressing right along to my next thought, which is, when we think about all of these things that we choose, what we have control over, and the things that we don't have control over, there are these anticipated or avoidable stressors or factors that contribute to stress. And I'm kind of most interested in understanding kind of, what do? We can anticipate that it'll be a problem. We know we should avoid it, but we don't. So things like late meetings, early meetings, or always rushing, how do we do that? So I just want to ask the panelists, just kind of name one thing that you anticipate as being a problem. You could avoid it, but you choose not to. Let's start with Yolanda and Caroline.
That's a good question. There always is a point in the day where we are called for a consultation, and inevitably in the hospital, and inevitably the equipment is not there when we need it, so it delays the day. And so unfortunately, I try to call ahead, but I know that I have to do a much better job of anticipating that is not going to be here, and it's going to delay my day and going to delay me from getting home. I have to think of a way to fix that issue. We are working with the OR staff that that fixes it and keeps it together. But yeah, there is a lot of work to be done. And I think on my part, I think I have to change my expectations and change my timing in order for it not to interfere with, with my home life and my family life. So and we were talking about this before this conversation that we're having right now, and we came up with a number of things that we think that we can actually improve upon to improve our relationship when it comes to my work.
Wow, that's good. That's nice to know. And we haven't even finished the session yet.
I know.
Raj and Kavita, so tell me, things that you can anticipate as a stressor, you should avoid, but you make the active choice not to avoid it.
Yeah, so today's my clinic day, and at the end of clinic day, I have to sit with my fellows and research staff and have an espresso and a Cliff Bar. And I sit and I waste 15, 20 minutes easy, sitting there yapping away, and the nanny's on the clock, and I should be coming home. But I think it's what Rebecca said. It really boosts my mood when I have that time to sit at the end of a long clinic day for 15, 20 minutes, my legs crossed, sitting back with my team and asking how their day was, how clinic patients were, making that espresso, having the bar. It's what I got to do. So I feel a bit bad about it, but then I don't. So maybe that's what you're asking. It's avoidable, but I choose not to. It's sort of a guilty pleasure. But maybe I'll say it's more than that. It's probably a necessary pleasure, just so that I can come home feeling ready to go with the kids and the family.
Okay.
I guess for me, and I don't know if I assume it's the same at every academic institution, but the turnover sometimes can be so long, and it makes, internally I get so irritated because I'm like, I could be done in half the time today and go home and do all of these other things, and I cannot, because I must wait for the patient to get pre-medded and come into the room and all this extra stuff, wake up, get intubated, wake up, and and so I've been trying, I'm better. I think the fact that I've gone to multiple different academic institutions, and I realize it's the same everywhere, that it allows me to get a sense of calmness and be like, this is how it is. And so instead of being irritated, I now walk to my office and back. And so I try and get many steps in that day. So I'm like, okay, I'm going to do this so I don't have to work out when I go home, or work on a paper or do something that I would normally do. Of course it's a little bit piecemeal, so I don't appreciate that, but trying to do that. So I'm trying to multitask.
Yeah.
Dealing with it.
Anyone else want to chime in? Carol?
Yeah, so I want to echo that. That used to be the turnover time, and if it's 5 or 6 cases and it's 45 minutes, it would make all the difference. And the later it got in the day, the longer the turnover time would be. Sometimes it would be 2 hours. I remember being 2 hours once on, and so I started a case at 8 p.m. I think it was Good Friday. I was out of my mind because you can put yourself into a tizzy. So one of the things I had to actually accept is that I can't control what's out of my control. I would advocate and talk about trying to run the room more efficiently, but I sort of gave up being home in a timely fashion on my OR days. And I think it was easier to manage, because sometimes if it drives you crazy and you can't control it, it just drives you crazier and crazier. And so I just resigned myself. Now, there was one day that I was trying to get out it was a very reasonable schedule. I had plenty of time with any reasonable turnover time, but I played in a tennis league, a doubles tennis league. And what I did that morning, later on in my career, I sort of shared in our medical team training, I shared with the team I was working with that I was on a team and the match was at, it might have been at 6:30 or 8 o'clock, but it might have been 6:30. And boy, I would really appreciate everybody's help because I didn't want to, it wasn't about me, but I didn't want to let my team down. And you know what? The team ran a beautifully efficient OR day that day. I got out in plenty of time. So it's just sort of an interesting nuance about talking about, or maybe it's a child's violin concert or a child's, athletic event. But I do think sharing with your team, so sort of what you're trying to get to, you never rush surgery, patient care always comes first. But I just think sometimes it's worthwhile to share sort of in a medical team environment what the goals are for the day. It's fascinating.
Yeah, I've experienced that too. It seems like it just becomes efficient. So now I go in and say, okay, I have a meeting at 4 that I need to make. My daughter it seems to work. I mean, I abuse it, but it does work.
We won't share.
Right. Well, I wanted before we close up, I do want to get to some questions in the chat, and then I want to hear some tactics and strategies from Rebecca before we close. So there are a couple of questions that I'm going to touch on. So Amy Chen asked, she'd be interested in knowing what is unique about having a 1-physician marriage versus a 2-physician marriage.
Is that for me?
Mm-hmm.
Yeah, that's a great question. And there has been a good bit of research around this. So, okay. And again, the research is done on more traditional marriages and it varies depending. So the most traditional is male physician married to a female who is not a physician. So we'll use that as an example. And so I'll compare it to a female married to, well, it doesn't even have to be female, but non-physician married to a physician. Let's just say that. The interesting thing is if you look at men physicians, the vast majority of them have a spouse who stays home and takes care of everything child-related, house-related. If you look at women physicians, the vast majority of them are married to a man who works as much as they do in some cases, maybe not in medicine, but in a different. And the woman is still doing the vast majority of household. And I've had countless conversations with women physicians over the years about, particularly in a surgical specialty, I work with all men whose wives do everything. And so when I have to take a day off because my kid is sick, they're annoyed and don't understand why. And, they've never had to do that. And it's just this really unconscious bias that women particularly navigate. For both those scenarios, physician married to non-physician, again, the biggest predictor of satisfaction is being congruent, being in agreement about who's going to do what are the jobs. If you're getting home earlier than me, do you prep dinner? I had this one physician, it was so funny. She said, we, in the early years of our marriage, we learned the really hard way that if, she was a physician married to a non-physician. She said, when I'm driving home at 7 o'clock at night, you do not call me and ask me what's for dinner. You are the one deciding what's for dinner. We learned that real quickly that's not going to work, right? So it's these tiny little things like that, but you times it by 1,000,000 and it makes a really big difference. 2 physicians married to each other. Again, this is fascinating to me to look at. When did you get together? Well, for all couples, when did you get together is an interesting question, first of all, because a common dynamic is, hey, we met while you were in med school. I didn't do medicine, but I supported you through that. We went through residency. That was awful. I stuck with you. Now you're this hotshot surgeon and I'm over here and you think I'm boring now, or you think I'm not as glamorous and I'm the one who's been here from before you were anybody, you were worried about passing your boards or whatever. So there's that dynamic. That's interesting. The other thing is if you meet, let's say you're both in medical training, when you meet, the beginning of a relationship is when it should be exciting and hot and heavy, and you're doing all this fun stuff, and you're both getting slaughtered every day, and you're not sleeping, and you know, the amount of time you even spend awake with each other is minimal. So that sets an interesting precedent. Sometimes, you know, people sometimes yearn for that. It feels like we developmentally missed a stage of our relationship in a way. But again, two physicians married to each other, a lot of advantages as far as understanding each other's stress. The biggest challenge is going to be time. And I would definitely encourage those folks and anyone with a physician, married to a physician, use your resources. You really, you know, you got to get your head out of the clouds, particularly as surgeons. You have to optimize your energy. You know, if you're going to be a medical family, you will deal with a lot. You will deal with a lot of really hard stuff. You need to save your energy and get your head out of the clouds and get realistic. Some of what you guys were just alluding to, you know, look at lessons from recovery, for example. Focus on what you can control in order to preserve some coping energy for the things you can't control. As surgeons in particular, you're going to have a lot of that anticipated but unavoidable stuff. Slow turnover of rooms, difficult colleagues, nurses turning over constantly, disruptive work stuff, you know, patients who are not adherent. You know, the people who enjoy medicine are the ones who understand the cavalry is never coming to fix all of this. And there are no perfect workplaces where this all feels really, really different. The same is true with frustrations in life. You know, some things may be anticipated and unavoidable. I'm going to work long hours. Our kids are going through the teenage years. You know, the infatuation stage of our marriage has kind of faded, and now we're settling in. If you're naive, if you think any of that is going to be avoidable, the people who end up happy are typically the ones who accept, like, this is going to be a journey with some ups and downs, but the more I can focus on everything that I can control to keep myself as healthy and resilient as possible, and the better we communicate with each other, the more we're going to have some reserves of coping energy to deal with all this other stuff we can't control. Does that make sense?
Yes, that makes great sense. Time seems to have flown by, and I want to give you an opportunity to give our folks some tactics or strategies that you think are great takeaway points from this discussion. If you could just give us kind of things that we should focus on for strategies for successful relationships, that would be great, so that, you know, people feel like they learned something.
Yeah. Well, I want to thank you guys and thank the panel. I mean, y'all are all great. I feel like you guys could teach a class on how to do this well. I will say this. I think a key thing to remember is, if you look at marriage, everybody has ups and downs. You know, if you look at a graph of intimacy over the years, what happens is it's sky high in the beginning, right? Intimacy is not just sex. Intimacy is saying I love you, being nice to each other, saying you look pretty, whatever. Sky high, you know, starts to you settle in a little bit. Around 7 to 10 years into a relationship, the graph literally bottoms out, okay? And everybody wants to blame it on the kids. Well, that's when you're having kids. The same things happen to childless couples. So there is this dip. 10 to 15 years in is when some of that shiny newness has worn off. That also is when people's careers tend to peak. It is also when people tend to be raising kids. Those are all factors, but it's true for everybody. The couples who make it out of that, there are some people who stay at this relatively low level of intimacy, but a lot of people climb out of it. But they're the ones who decide to do the work, and they decide, we don't want to feel like this. We got to start communicating differently. Let's get into therapy, or let me take responsibility for my stuff. Let me get happier so that, our marriage feels better, whatever those strategies are. But you have to accept that it's a journey. If we both know it's a journey that's going to go like this, then we're better able to navigate those times. The other thing I would say is, we're not looking for an absence of conflict. The research tells us happily married couples have on average 12 chronic unresolved issues that they always are going to fight about. 12, that's the happy people. And they are very often the same issues at year 20 or 30 that they were at year 1, and it's fundamental stuff like, well, you're always late now and I want to be early, or you're, extroverted, introverted, whatever, these fundamental difference. So it's not an absence of hassles that predict satisfaction. It's really important, though, to communicate in a way that helps you preserve the friendship in that relationship. The biggest predictor of divorce is loss of friendship. It's not loss of love. Almost everybody going through a divorce would tell you, I still love that person. What we lost is friendship and a sense of respect for each other. And that often happens in the way we navigate these 12 chronic issues. So we want to make sure to look at those issues as paradoxes as opposed to problems. A paradox is that this might have 2 right answers, or 2 different solutions. It aggravates the heck out of me that your solution isn't the same as mine. But we get into trouble when we turn it into a problem and we start doing character assassination. I've decided that you're messy because you're a narcissist and you just think I'm your maid. And so you're just going to leave stuff all over the floor, right? That's a problem if we start assuming that, as opposed to you're messy. You don't love the tidy house the way I do. I love it a lot about you. Your messiness sometimes makes you more laid back than me. And I love that about you. But, and so I can accept this as a way in which we're different and we figure out how to navigate it without hating each other. So those are the main points, keep some of that coping energy, control what you can to make sure think of those bank accounts of energy. You have got to do whatever you can do to have some reserves there. And I think the panel had some good tips on navigating that. The other thing I'd say for medical families, having community support is really important. And one of the biggest symptoms that medical families report is we feel kind of lonely. We feel kind of misunderstood by our community, by, the other moms on the soccer sideline really don't understand why I miss half the games. They have no idea what I do or what our family has to navigate to make it happen, that I actually came to this game. Just you guys deal with a level of stress that very, very few people understand, and it can feel really isolating. So whatever you can do to garner support, forums like this, these types of meetings, I commend you guys for doing this, because creating this type of community is another really important thing to support medical families.
Thank you so much. I found that all very insightful, and hopefully I can take these tools and apply them.
Absolutely.
And so we're at 9:03. Any final comments from our panel? Carol?
I just want to say thank you all who joined us this evening. My colleagues, my co-panelists, Minka, great moderation of the panel, great questions, and Rebecca, wow, should have talked to you 25 years ago, because you've really summed up, I think, shared some really workable tactics and strategies to manage this, what is, I think, a wonderful, amazing career and life, but also a really stressful and challenging career in life. And so thank you so much. What I've been scribbling notes, because you're really just huge bits, nuggets of wisdom, really. Thank you, Rebecca.
Angela?
Yeah, I also wanted to thank everyone. And since Greg and I are in the second round, I also wanted to just comment on the fact that it doesn't always work. Despite our best efforts, I was divorced as a chief resident and met my ex-husband as a high school student. And we were together 15 years. And my husband was with his ex-wife for 26 years. So there's never a point where you're excluded from the possibility of finding love and being happy, and finding that relationship that is supportive, as challenging as our lives as surgeons may be. And a lot of the circumstances that Rebecca mentioned, I think, are what derailed my relationship with my first husband, who is still a great friend and we co-parent wonderfully. We just realized that there was a crossroads where my career was going to take me in a direction that he didn't want to go. Because he also wanted to have a career that someone could follow him. And we couldn't both be followers at that stage in my life. And so I don't think that that is a circumstance that anyone in our audience would find foreign, because I think we may each experience through relationships that there are moments where one of us has to lead and the other has to follow. And when it's a two-surgeon home, I think those decisions you kind of have to make almost in advance. Like you have to decide at what point in the career am I going to step back and let you lead? And then am I going to choose to step back and let the other one lead? And if you can't have those discussions candidly with one another and value each other's careers and lives equally, I think that's one of the reasons that relationships can tend to go south. And so I'm really thankful for this panel, for Greg and I, because he's new to this space, to see that it can and it does work for a lot of us.
Yeah. Okay, well, thank you, everyone. Have a great evening. I really appreciate you all. Thank you, Rebecca. Thank you to the panelists, and thank you for everyone that joined this evening. Bye-bye.